we're preparing for 2024. So legislation is over, but we are preparing for 2024. So I wanted to hit a couple of hot bills with you that impact you. 252, Senate Bill 252. That is the bill regarding protection from discrimination based on healthcare choices. So this bill required the agency, in conjunction with Department of Health, to do a rule. So we started with an emergency rule, and that emergency rule is specific to facial coverings. Facial coverings. So that rule, emergency rule, has been done. That was sent out on June 30th, right before the deadline, because we were due July 1st. So did everybody get an alert with that emergency rule? Did everybody get that? Okay. If you didn't get that, let me know. It is posted on our agency's website. But you are required, starting July 1st, to follow that emergency rule as it relates to facial coverings. The rule and the statute under 252 requires you to write a policy based on the rule that we sent out for facial coverings. Again, if you don't have it, I know the leadership at FALA has it, but more than happy to send that to you, and it's posted on our website. Now, we are moving into final rulemaking because emergency rules expire after 90 days. So we're moving into final rulemaking. So make sure that you pay attention to the emergency rule because we'll be using that language as we move into final rule. And final rule is open for comment. You know, when we do a rule, we'll be sending that information out. We'll make sure it gets to your leadership at FALA so they can make you aware. But obviously, you know, you're in your facilities day in and day out more than we are. So we definitely want your input as we move into that final rulemaking. So the other thing I want to mention is healthcare provider accountability, House Bill 1471. 1471 is our agency bill. Our agency bill, and it addresses unlicensed activity. So those of you who live in South Florida, I'm sure you read the news a lot, get all the, whether it's, you know, the TV stations or articles that you see about these recovery care homes. Anybody heard that terminology? Yeah. People in recovery care homes? Just so you know, there is no such provider type. Recovery care homes, there is no such provider type. If you are operating a recovery care home, you're operating an unlicensed facility. And we're going to come after you and do a survey. So one of the things that we have found over the years, and it has grown over the years, is these companies who run these like recovery care homes. Individuals go for like plastic surgery. The big ones were like the Brazilian butt lifts. You may have heard that terminology. It's crazy what people do, but anyway, they pay a lot of money for it. So they'll go have these cosmetic procedures, and some of the surgery offices will have like agreements with these folks that run these unlicensed recovery care homes. And because of the type of the services that these homes offer, it is assisted living facility-like. They are providing medication assistance. They are providing assistance with ADLs, offering meals. So because of that, we've done, and we've seen an increase over the years of doing unlicensed activities. So what this bill does for us, House Bill 1471, gives us a little more teeth for us to take action, for us to go through the ex parte order, to be able to immediately take action. Because when we do an unlicensed investigation, and we find that somebody is operating an unlicensed location, whether it's an unlicensed ALF, an unlicensed healthcare clinic, we've had that happen, unlicensed home health agencies. We give them a notice, and they're supposed to cease and desist right away. A lot of times they don't. They're fined $1,000 a day until they cease operation. So, but with the ex parte order, because of the type of services that are being provided, we've been very concerned of possible death related to these services. And as many of you know who live in those areas, you've seen that we have had some deaths related to this. So this allows us to take quicker action working with local law enforcement. This also allows to provide our survey documents to local law enforcement unredacted. We have had issues over the years of providing them documents. Normally they would have to subpoena us to get documents that were unredacted, but it's important that they get them unredacted, and so this allows us to go quicker through that process. So just wanted to kind of share that with you. I think there have been some questions about recovery care homes, but there is no such thing as a recovery care home. If you're operating something like that, and we need you to keep your ears to the ground about it. If you are hearing that they are kind of unlicensed, these unlicensed locations around the state, please raise those concerns to us. I think we went for years with just a horrible situation where we had a lot of unlicensed locations. We've done a lot of investigations over the years and kind of gotten that under control, but we still have some in certain areas. And for certain things like this, where folks are going for cosmetic procedures, and they're coming in from other countries, from other parts of the country. So please make sure you're alert to that, because it impacts all of us in the healthcare business.